Hey everybody, this episode is going to be a very packed episode. There are kind of 2.5 questions. The first one I'm answering in 2 parts. The second one is a standalone question. A lot of very interesting stuff. The first one is from somebody who's been dealing with mental health issues very significantly throughout their whole life. And they wanted to know, is their decision to not have biological kids strange? They also wanted some help navigating the prospect of going into inpatient treatment. So we talk about some of the ins and outs of that. The second question is from somebody who is a trans man on testosterone, meaning they are getting excess testosterone as part of their gender affirming care, and that's making them very sexual. And their partner is having the opposite experience where their partner's testosterone potentially is going down and they're becoming less sexual. So they want to know how to deal with that, what they can do in terms of communication or other strategies to improve that. So I hope you enjoy this episode. I had fun making it, and let's get to it. This is the Hardcore Self-Help Podcast. I'm your host, Dr. Robert Duff. I'm a clinical psychologist and a self-help author from Southern California. My goal is to make mental health content for real people, just like you. And in this show, I answer your questions or dive deep into topics related to life, psychology, mental health, relationships, and more. Please be aware that sometimes I use some spicy language, and I also don't shy away from sensitive topics, but I will try to give you a content warning whenever it's relevant. So if all this sounds good to you, let's get started. All right. Hello, friends of all varieties. Thank you so much for joining me. This is episode 398. I appreciate you being here. I'm happy to be here. I feel like I am constantly updating you on my status and health and things like that, but I need to give you a quick update again this time just for context because my voice has been pretty wrecked. I can hardly breathe out of my nose, and it's not because I was sick. It's because, well, I'm not going to give you the full details. If you want the full details, you can go to my Instagram at Duff the Psych on Instagram. I did a whole breakdown post there talking about what happened. The long and short of it is earlier this week, over the weekend and into Monday, I was in 3 ERs in 3 days for a severe bloody nose that was pretty scary and bad. And I've never had anything like that. And all sorts of treatments and, insurance bullshit and blah, blah, blah. But yeah, it's been a bit of a recovery. I'm doing well now. I'm on the mend, but that was definitely something to go through. And I still haven't fully recovered in terms of being able to breathe again. So I'm going to be, a little bit nasally and such. Hopefully not too bad. The things I do for you guys, I sprayed Afrin up my nose, which is like a nasal decongestant spray, and plugged it up so it can sort of sit in there and try to open things up before doing this podcast just for you, because I appreciate you, the listener. But anyway, let's stop all that preamble and go ahead and get into the questions. A couple really good questions. This first one, I'm going to break into 2 different parts because it was a long question and there were kind of 2 different questions within it. So technically this will be like a 3-question episode. So here's the first one. It reads, Dr. Duff, I just found your podcast. I'm loving listening to everything. I've been jumping around searching by topic. You may have covered these, but there are a couple things I've struggled with throughout my life that I'd love some input on. I began struggling with mental illness around the age of 12. I'm 43 years old, and the majority of my life has been spent depressed, anxious, moody, irritable, dealing with side effects from numerous medications, changing medications, etc. My immediate family and extended family have all suffered with different mental health conditions. I decided years ago to not have biological children. I did not want to pass these genes down because who would really choose to live this way? I do not regret that decision at all, but people seem surprised by my reasoning. I feel like this is a logical decision. Do you know of other people who have made the same decision? Am I out in left field? Thank you. This is a wonderful question, something honestly that I don't think gets talked about enough, so I appreciate it. To answer part of your question, yes, I do know people who have made this decision that you're talking about. I know people that have made the decision to not have kids for many different reasons. For some, it's the concern about potentially passing down physical or mental illness. For others, it's that they've done enough parenting already of, say, their siblings or their own parents or cousins, anything like that, to last them a lifetime, and they're just done with it. For some, it's because they can't bear to bring a child into the world that has some of the issues that it has that they feel very strongly about. For others, it's simply because it's just not something they can see themselves doing. They don't want it. And unfortunately, you're right. People are quick to feel surprised or try to convince you that, oh, you'll change your mind eventually. That's going to change. You'll find somebody and this will happen and that will happen and you'll change your mind. There's a lot of people that feel compelled to try to talk you out of it. And I think that's unfortunate because you are 1000% absolutely allowed to not have kids. Having my own kids, right? I have I have a 6 and an 8-year-old. And this has made me even firmer in that belief. Parenting is not for everybody, and it does not need to be. Before talking about the logic of the decision at all, I just want to say that nobody is in a position to judge you. You are the one who has struggled with mental illness for the vast majority of your life. You're the one that knows what that feels like. It is totally reasonable for that to be part of your decision-making process when it comes to children. You said that you've not regretted this decision at all, and I think that's great. That means it's a genuine decision and that it's in line with your values. And that's really what matters. Other people, they can suck it. It's not about them. Now, you also asked if you're out in left field. You mentioned that to you, it feels like a logical decision. And I think there certainly is a logical element here. Most mental health disorders have a significant heritability rate, which is sometimes misunderstood. Heritability is essentially in research defined as the percentage of the population thought to have a given disorder that is caused by genetic reasons. That doesn't mean that, if you see schizophrenia with a 70 to 80% heritability rate, that it means you're 70% more likely to have it if your parent does. We're talking about at the population level, what percentage is contributed to by genes, not other factors. But there are also some estimates of individual risk factors if one parent has a disorder. And many of these estimates are substantial, right? I don't think that we need to shy away from this. A lot of the estimates are above 10 to 20%, which is absolutely significant. I think that should factor into your thinking when it comes to having children. There are obviously other factors as well, right? The impact on development and the environment for the kid with a parent that has significant mental health difficulties. There are many different factors to it. It's not all about genes. And of course, there are also counters to this, right? If a kid is going to experience mental health difficulties or tendencies toward mental illness, who could be better to provide a source of empathy and guidance than a parent who actually gets it, who has lived experience? Let's say that the other parent in the situation, if there are two that are present for the upbringing, let's say that the other parent doesn't struggle with the same issues. And what you get is essentially a kid that inherits a bit of a genetic risk, but also all of the wisdom and learning that you've accumulated over your life living with these mental health issues. And they also have a variety in the parenting experience, which can be great when it's done well and coordinated. So there could be potential benefits as well. I think there's also a potential slippery slope with, really sticking firmly to the kind of reasoning about just not wanting to pass genes down to the next generation that have this issue, which, would imply that there's something inherently wrong with having mental health issues, or that life is less worth living given the possibility that they could occur. I don't think that's necessarily true. And this definitely isn't to say that you should have made a different choice, but it's okay if others don't make that same choice as you, as long as they're prepared to step up in the best way that they can, because there is more of a risk that their kid will have mental health difficulties that may be the same or may be different. So it's definitely not something to completely ignore. It's something that is allowed to factor into your decision making. And when it comes to yourself, the combination of your own experiences, your feelings about not wanting to potentially pass down similar issues, and the various and abundant reasons that not having kids or deciding to adopt instead of having biological kids are totally great alternatives. Between all those things, you have a lot backing your decision, and I don't blame you at all. Nor does my, blame or my opinion about your decision matter. It is your decision, right? It is your body. It is your life. As I said, you're the only one who knows what you've been through, and everybody else, their opinion does not matter in this case. So thank you for asking that part of your question. I'm going to go ahead and get into the second part, but before that, let's take a quick break and talk about our first sponsor for today. This episode is brought to you by OneSkin. I'm a big fan of theirs, and I use their products daily. It can be hard finding something that's great for daily use, especially if you have sensitive skin, but OneSkin makes it easy with their topical supplements that are formulated with soothing ingredients and natural antioxidants. OneSkin is not just about moisturizing your skin, although it certainly does that. Their products are driven by a peptide they created called OS1 that targets skin aging at the cellular level by targeting senescent skin cells. These are the cells that cause aging. And this strengthens the skin barrier and diminishes visual signs of aging, such as wrinkles. OneSkin is all about skin longevity. And if you would like to keep your skin healthier for longer and acting younger for longer, get started today with 15% off using code DUFF, D-U-F-F, at oneskin.co. That's 15% off at oneskin.co with code DUFF. After you purchase, they'll ask who sent you, and be sure to show support for the show by letting them know. All right, let's get back to the questions. Okay, so on to the second part of your question. It reads, also, I'm at a point in my life where my provider and I think an inpatient program would be ideal, but there are so many barriers. Getting disability paperwork filled out and filing FMLA, which is Family Medical Leave Act, so I don't lose my job, going through the clinic assessments and insurance approval and patiently waiting until they have an opening, managing my bills, house, dog, etc., seeing if I have enough money to pay my out-of-pocket maximum, the amount of work that goes into dealing with the U.S. healthcare system, insurance, and big pharma. Honestly, I don't know how people do this. Tips? So again, another great question, and I absolutely feel you on this. I've shared this on the show before, but my wife has been hospitalized before, both voluntarily and involuntarily, and it can be such a fucking disaster working with insurance. They truly aren't there to help. They are there to make money. And I don't know that other countries fully have it figured out. Every country has its pluses and its downsides when it comes to healthcare. When you ask people who live in a given area, sometimes the rosy way that you might see it from the outside isn't exactly how it plays out. There are certainly countries that have it much better than others and have it way closer to figure it out. But just as a field, with mental health or physical health, dealing with insurance, it can just suck. I remember after my wife's first hospitalization, this was the involuntary one, she was discharged, right? So she was able to get out. And after she came and, gave me a hug, went to go pick her up. It was sort of like the reception waiting area. Gave her a hug and they called her up to the window. They're like, Joelle. And then she came up to the window and they just decided to right then tell her how much money we owed, which was a good amount in this case because of our insurance wasn't that great. The circumstances, how it goes. And she was just like, do you want me to turn around and walk right back in there? Like, money is a huge part of the stressors that I'm going through. And that's the first thing you say upon my discharge. In my recent hospital experience, right, I mentioned I was in the ER a few times over the past weekend. Somebody literally walked up to me while I was bleeding profusely into like a basin that I was holding on my lap with just, I didn't get very good treatment at this hospital. And there was just like, bloody rags and all this stuff around me. And I'm just bleeding in this basin. And she walks up to me with a little computer and it's like, it looks like your copay is blah, 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 $100. And I just what am I going to do? Whip out my wallet right then? Like, sure. You take cash. Like, I basically looked at her like, are you fucking kidding me? Like, get away from me. So yeah, all this is to say, I can absolutely understand being salty and frustrated working around all of the limitations and, not just insurance, but all the other things about life that you have to figure out. Unfortunately, mental health issues and mental health treatment don't happen in a vacuum. So the rest of life continues on and we have to figure out a way to wedge it in there, right? We don't live in a society where you can just be like, you know what? I'm abandoning everything. I'm focusing on myself. And we're not able to do that without recourse. So sometimes it can be absolutely worth it to do inpatient treatment despite the limitations and how difficult it is when you consider the alternative, which would be not having any chance of recovering or doing better. But I think it's important to first just avoid gaslighting yourself about the fact that it does take a ton of effort to try to set something like this up. It's not just you. I do have a few thoughts for you. First off, have you guys, meaning you and your providers, considered alternatives like an intensive outpatient program, IOP, or a partial hospitalization program, PHP? These are programs where you're doing intensive treatment, where you're going to be at a clinic or a facility for a lot of the day, basically most days of the week, sometimes every day of the week. And this will include a lot of stuff that you would see in inpatient treatment, like group therapy, individual therapy, medication management, case management, maybe some experiential stuff, all of that. But it's done in an outpatient basis, but again, very intensive. The terminology can vary from place to place. In some places, IOP and PHP are almost exactly the same, but technically PHP is supposed to be a higher level of care. That would be basically the next best thing to inpatient. So you're going to be there most of the day for most of the days of the week. And so it's basically, you don't stay there, but all the other parts of being hospitalized are there essentially. If you do want to pursue inpatient treatment, which I'm super proud of you for even talking about it with your provider, because that means that you are trying here. Maybe you could get some additional help with this planning phase. Maybe, for example, finding a human to talk to at your insurance company, which I know can be a challenge, but finding a human to talk to point you in the right direction. That could be helpful to see what are your financial options. Do they have any sort of programs that are for people in a situation like yours? Maybe they can help you out with finding a care manager, like a complex care manager that can put some of the pieces together for you or give you some guidance through this. You may also want to think about your own personal support network. There's no shame in rallying the troops if you have them, your village, your people that you have around you, and asking if anyone can take any of these pieces off your plate, or even simply help you figure out some things like, hey, I'm at my wit's end. I can't figure this out. Can you help me? Because as I said, it can absolutely be overwhelming. But I think by addressing these steps one thing at a time, you can definitely make it happen if you need to. Aside from hospitalization, I'm curious, have you also already explored other types of treatment? So what I mean is treatment for treatment-resistant depression or treatment-resistant mental illness in general. For example, getting a course of ECT, right? Electroconvulsive therapy, accelerated TMS, or ketamine-assisted therapy. Even if certain of these approaches to treatment-resistant depression and mental illness are not fully covered by insurance, you might still want to look at the comparative cost of your out-of-pocket maximum for getting hospitalized versus the cost of this treatment. And potentially it could be spread out over time. You can work with the companies, etc. I've talked about all of these approaches before. I think I've talked directly about ECT versus ketamine. I've talked about a roundup of different approaches for treatment-resistant depression. So be sure to go to the website, go to duffthepsych.com, use the search bar, search for things like ECT, TMS, ketamine. There's a lot of different approaches that are meant to sort of draw a line in the sand and really try to do a bit of a reset. Ketamine in particular, the long-term efficacy, the data aren't really there for that because you do need boosters, you do need continuous therapy for that. But the immediate antidepressant effect and the ability to pull somebody out of suicidality cannot be understated. Right? People go into 1 or 2 ketamine sessions and they can just turn around from being suicidal to having hope. And I think that is incredibly powerful. A couple things though. TMS, so transcranial magnetic stimulation, and ketamine nasal spray, which, if you were able to choose from any approach, I don't think the nasal spray is what I would choose, but it's totally still, efficacious in the research. Those are both covered by the FDA or approved by the FDA and are often covered by insurance. ECT is almost invariably covered. That's the kind of gold standard for treatment-resistant depression, even though it sounds scary. So that's usually covered in a hospital setting. There's something called accelerated TMS, which appears to be more effective and is offered over a shorter period. So instead of going for 30 days or something like that for short treatments over and over and over each day, you're going to be going for like 5 days, but it's more like 10-minute sessions within one day. So long days where you're getting a bunch of treatments, but it's all packed together, and it uses other techniques like neuroimaging to try to be more focused. And yeah, the research is really great on it, but it's not really covered by insurance right now. So another thing to consider. I'll include a link to a blog post that I did. I've been doing more blogging for my day job, my clinical practice, Insight Neuropsychology. So if you go to insightneuropsychology.com and go to like the news and blog section, I have some recent blog posts on there. One of them is about accelerated TMS. So I'll try to link that in the show notes. So all in all, I think there are a few things to consider for your situation. There's a few options for different modes of treatment. There are also some resources to think about, as I mentioned. But no matter what, this is definitely a challenge to navigate, and I'm proud of you for pushing forward right now. And I hope that things ease up a little bit for you and that you can enjoy life for at least a period where you're not as burdened as you are at this moment. I know that we can't expect things to just disappear, but it sounds like you could use some relief. So I hope that you get that. And I appreciate you listening to the show. Okay, so that's it for that question. We're going to get into an entirely different question now. But before that, another quick sponsor break. This episode is brought to you by BetterHelp. We all carry around stressors. Some of them are huge and monumental. Some of them are little things that just nag at us every day. But when we keep them inside, it can impact us negatively. And truthfully, they usually find a way to get to the surface, whether that's during sleep or when you accidentally snap at someone. Therapy is a great place to get these things off your chest, so they're not rolling around in your brain all the time. And if you're thinking about starting therapy, give BetterHelp a try. It's entirely online and designed to be suited to your schedule. Just fill out a brief questionnaire and that'll get you matched with a licensed therapist, and you can switch therapists at any time for no additional charge. Get it off your chest with BetterHelp. Visit betterhelp.com/duff today to get 10% off your first month. That's betterhelp.com/duff to get 10% off your first month. Okay, on to the next question. It reads, "Hey, Dr. Duff, love you and the podcast, especially the curse words, LOL. Fuck yeah. My partner and I are in our early 40s. I'm a trans man and my partner is a cis man. I've noticed his sex drive has been slowing down as we age, which I know is normal. However, my sex drive has still been going strong, in capital letters, due to being on weekly testosterone injections. I've tried gently bringing up my partner's dwindling sex drive before, which makes him get very defensive and change the subject. I've also tried buying new toys, practicing new sexual experiences like sensory deprivation, tantric sex, etc., and spontaneously getting very flirty and handsy with him to make sex less routine and more exciting for him again. He always says he's not interested or not in the mood, which is growing more concerning and frustrating for me. I suspect low testosterone levels, or ED, which is erectile dysfunction, are the cause since the change has been gradual and seems to be getting worse as he gets older. He does have a primary care doctor, but refuses to discuss this with them. How can I encourage him to get checked out for low testosterone or other medical causes that may be causing this? Or do you have any general advice for dealing with his insecurities / lack of a desire for sex while my sex drive is still very high? Thanks in advance." Thank you for the question. There are elements of this that I think will be relatable to many people in relationships, and some that are probably unique to your circumstances. So some rich stuff to get into here. I want to clarify terms for anybody that maybe isn't totally getting it. The person asking the question is a trans man, meaning they were not assigned the sex of male at birth. That's not what was on their birth certificate. They popped out and, the doctors didn't say, oh, it's a boy. But they identify as a male, and they know that he knows that his gender is male, right? That's his gender identity. He knows internally he's a male. Body didn't quite line up with that in terms of what we assign as a sex at birth, but he knows that he's a male, right? So he's a trans man. This may or may not involve surgery or hormone replacement. It may or may not involve changes to gender expression, meaning how you act and dress and present. However, in this person's case, he said that he's on weekly testosterone injections, which is important for context. We'll come back to that. Now, his partner is a cis man, which, contrary to some people's belief out there, is not some sort of derogatory term or something that you can, identify as. It's simply a descriptor. Cis means consistent, right? So cis man, which means simply he's a man that was also assigned the sex male at birth. So he popped out and they said, oh, it's a boy. And would you know it? He is a boy. His biological presentation matches with his gender identity. Therefore, he's cis, just like me. I was born a boy and I identify as a man. That is who I am. So hopefully that's helpful to anybody who may get tripped up on the terminology. That terminology aside, there are a couple things that I want to first normalize here. First off, it is hard to talk about sex in most relationships. It's not a sign of a bad relationship if it's difficult for you to talk about sex, especially when sex is an issue that's causing discomfort or some sort of strife within the relationship. Communication is super important, but it is hard and it can be awkward. There's no perfect way to do it, so don't beat yourself up for not having found a perfect solution yet. You also said that you are in your early 40s. These days, that doesn't seem so old, right? We tend to live longer lives, and 40s are, what do they say? 40s are the new 30s or whatever. So 40s doesn't seem that old, but it is totally normal to have fluctuations in libido and sexual interest throughout your life, especially as you crest from your 30s to 40s. I would also say that the variability in sexual interest and desire is probably higher than what you would see for people in, say, their 70s. There are plenty of people who are sexually active in their 70s, but there are many people who are not. So a lot more people in their 70s are going to have that decreased sex drive, but people in their 40s can be all over the grid. There are some people who are living their best sexual lives right now, and there are others who are slowing down and really feeling like that's not a priority. So it makes this time of life, I think, more prone to mismatches in desire when you're in a relationship. Your mention of testosterone is very interesting. You're taking it likely for gender affirming reasons, meaning you're trying to have your physical body match more with what you see as your gender identity. So you have a much higher amount of testosterone than you would have if you weren't taking that, obviously. Whereas your partner might be having kind of the opposite issue where they're seeing an age or health related decrease in testosterone. So you guys might be sort of moving toward opposite sides of the scale at the same time. Obviously, it's important that we don't make random speculation about your partner's health without context, but that would be a pretty common issue for somebody in their 40s. So it's certainly one possibility among others. There are some things that I'm curious about here that have to do with your relationship in general. First off, I think it's always important to consider whether the sexual issues in a relationship are primarily sexual in nature, or if they're secondary, like a symptom of something else happening in the relationship. I don't have a whole lot of context about the quality of your relationship and your communication, but can you identify any reasons that he may not be interested in sex with you beyond just a physical libido mismatch? Is there relationship discord, unmet needs on his end, resentments, high levels of stress in your life outside of the bedroom? These could all be things that weigh heavily upon him. And aside from the relationship, there's certainly things like his own potential decreased self-esteem, depression, other mental health issues, or even just pressure to focus on work and play the role of breadwinner, if that is relevant in your case. All these things could potentially decrease somebody's interest or desire for sex. For your situation in particular, right, given the fact that you are trans, I don't know when your transition began, if it was sort of there was a marker there where you definitely began a transition in gender, or at least, coming out and being open about that. But that would also be something to consider. The way that you worded it made it sound like you may have been together for a while. So if he's been with you through your transition and didn't know that you were trans from the outset, that would certainly be something that could be difficult for him. It's a tough situation, but I've seen it before where one partner wants to try their best to remain in a romantic and sexual relationship with their partner as they go through a gender transition, but they're just simply not attracted to people of that gender. And that's not what they were expecting when they went into the relationship. It's a hard thing to talk about, though, because the last thing the partner would want to do probably is guilt the person, the trans person, for being themselves, right? They still do love them as an individual. That doesn't take anything away from what they've been through. But the relationship, sexually or romantically, may not fall under the umbrella of the genders that they're attracted to anymore. And that's just some real shit that happens, right? It's tough, and it's something that people navigate in a variety of ways, but it can be something that plays a role. I'm not saying that this is the case for you, right? I don't know that information. For all I know, you were transitioned and out well before you ever met your partner. But it's a situation that does sometimes require really honest and tough, sometimes guided conversations and discussions. I would also ask, is there a chance that you guys need to work on communication in general? You mentioned that he gets defensive and doesn't want to discuss the topic when you bring it up. Is this only with the topic of sex, or do you find that communication about anything, especially sensitive topics in general, is difficult? The reason I ask is that it sounds like you've been trying to find a lot of different ways of addressing this issue. Conversation, try new things out in the bedroom, try new things behaviorally between you two. But from, your standpoint, what you're writing here, it sounds like you're maybe the only one putting that effort forward. Obviously, I could be wrong, but again, it's important to take a step back and look at the relationship itself aside from just the sexual issues. To be clear, you're doing absolutely nothing wrong by having sexual needs. You're human. We all have sexual needs. It's a basic primitive thing. I come from a unique perspective that I'm sure most of you know about of being non-monogamous, meaning I don't have one romantic sexual partner. But my wife and I were just talking about this, actually, just talking about how one aspect of monogamy that doesn't make a lot of sense to us is just this expectation that you kind of are supposed to, this is a bad term, but like go down with the ship when your partner loses sexual interest or becomes less of a sexual person. You don't lose your status as a sexual being once you fall into a committed relationship with somebody. And in my opinion, it's not fair that you would have to be unfulfilled and also essentially stuck for the rest of your life being that way, right? If the expectation is you are with this one person, whatever works out between you is what happens, but you don't get anything else. So, that if you are staying together as long-term committed partners, then that's what the expectation for the rest of your life. That's tough. If your partner is not interested in sex anymore and he doesn't feel like it's something he wants or needs to change, I wonder if conversations about non-monogamy would be something to consider. Now, to be clear, this is something that would probably hurt his feelings to bring it up. I just want to make sure that I'm forward about that, right? If he's defensive because this is an area of vulnerability in terms of his self-esteem, if he feels bad about it, but just doesn't want to approach it because it's too big of an issue, etc., knowing that you would like to seek connection or satisfaction elsewhere because he's not going to work on improving the sexual relationship will likely be tough for him. That's a blow for sure. Like I said, these conversations are difficult, and absolutely non-monogamy is not for everyone. I'm going to say that for everybody in the back. Non-monogamy is not for everyone. I don't want you all to be non-monogamous. Some of you might be a good idea. Other of you, definitely not a good idea, right? I'm not here to spread the gospel of it and be evangelical and say, hey, you all should be doing this. But I think having an open mind and considering alternative possibilities, in some cases, it can actually help, right? There are situations where it can absolutely help you focus on the parts of your relationship that work really well and stop stressing so much about the parts where there are mismatches. This may be an indelicate comparison, but in my work as a neuropsychologist, a lot of times I have somebody bring in their spouse for assessment. Maybe they're growing to have dementia and they require caregiving, and the spouse is trying to be a family member, a life partner, a romantic partner, and a caregiver all at the same time. And they feel a responsibility to do that because they feel like they need to be everything for that person. And often I'm talking with them about, hey, you should get some professional help here. You should get somebody to step in and do the caregiving so you can focus on the parts of your relationship that are good. Focus on being a partner and a family member instead of the nag and the this and the that. Right. So obviously we're talking about different situations here, but sometimes offloading some aspects of what we unfortunately expect to be fulfilled by one person, it's kind of a lot of pressure for that to happen. Sometimes giving another outlet for that or another way for that to be fulfilled can be helpful in actually helping the relationship rather than hurting it. If you find that your communication is not strong enough to find a way to address this in conversation, you may need to enlist the help of somebody like a therapist. And if he doesn't want to do that, you might need to get a little bit more serious about this and express your concern that you are not having your needs met. And it seems like he's not willing to even entertain the idea of getting help to improve your relationship. Again, this is hypothetical, right? If he wasn't willing to do that, you would express that. Be like, hey, this is potentially a problem. And I hope it doesn't come to that. But I also don't think that you need to build resentment toward him or feel pulled toward something less ethical, like just overtly cheating on him. So those are some things to consider. I think the best case here is that you push a bit harder in the conversation department and don't take no for an answer when it comes to discussing this. And you may even have to be more clear that this is an issue that could potentially cause a rupture in your relationship and that you're in the interest or you're interested in saving the relationship and making it last. And so you want to work on that together. Beyond that, you also may need to reassure him that you're open to whatever the reasons might be, that mostly you're just curious and you want to talk about it so you can figure out where you guys stand. If that doesn't get you anywhere and he's unwilling to meet you halfway by working with a therapist or something like that, then you may need to take a long, hard look at the relationship itself. If he doesn't feel comfortable talking with you about it, maybe there's somebody that he does, and you can ask him to speak with whoever his sort of trusted advisor or confidant is about the topic. But ultimately, this is a basic need that you have. It's normal for you to have some compromises in a relationship because it's rare that everyone's sexual needs are perfectly aligned all the time. But it sounds like we're getting beyond just some mild compromises here, and this is getting into territory that could be problematic. Obviously, I'm getting this information from your perspective, so you may also want to gather your own feedback from your trusted advisors about the situation and about if you're being reasonable, etc. But ultimately, you're finding yourself unhappy in this department, in this aspect of your relationship, and it's important to you, so it's worth paying attention to. And I really hope that this gets better for both of you soon. And with that, that is the end of the episode, everybody. Thank you so much for listening. I appreciate you. Take good care of yourselves. Hopefully you are physically healthy and well, and I'll work on being the same. I will see you for the next episode. Bye. Thank you so much for joining me in this episode. If you would like to send a question or a topic for a future episode, please email me at duffthepsych@gmail.com. If you like my approach and would like to learn more about my books, online course, or other resources, please head over to my website at duffthepsych.com. And lastly, it would mean so much to me if you would leave a review for the podcast wherever you listen to it, or share an episode with a friend. Until next time, you got this.